I'm Dr. Ken Landau. Thanks for watching. Let's talk about Siliq. Siliq, or brodalumab, is a drug just approved in February of 2017 for treatment of moderate to severe psoriasis. It's going to be marketed starting sometime in the third quarter of 2017 for moderate to severe disease for patients who are bad enough to warrant either phototherapy or systemic therapy, not just the creams, and for patients who have already tried some other kind of systemic therapy and the systemic therapy didn't work. So then this would be potentially an option. Psoriasis, very common disorder, affects somewhere around 8 million people in the United States. Most of the patients have what we call chronic plaque-like disease with big patches of red, scaly skin symmetrically placed on the right side and left side of the body, tends to like to be on the elbows, the knees, tends to like to be on the scalp. Sometimes it's on the back, or for that matter, it could be anywhere. The disorder tends to begin either in youth, between the ages, say, 15 and 20, or in adults between the ages of 55 and 60, and then once it begins, it persists forever. 80% of the time it's mild to moderate in intensity, but 20% of the time it's more severe. Seems that we call severe now more than 5% of the body surface area being involved. Used to be we say you have to have at least 10% of the body surface area involved to take some of these drugs because the drugs have some side effects and they're very expensive. The head of Valeant Pharmaceuticals, the company that is responsible for bringing this drug to market, they believe that it fulfills an unmet medical need. Now, it's a monoclonal antibody, one of those fancy things made in the laboratory, and it focuses directly on what's known as an IL-17 receptor. That's on the cell surface, and that chemical on the cell surface, the receptor, once it's blocked, it seems that it might prevent the cells inside the skin from dividing excessively. So that seems to be good. Well, unfortunately, because it blocks the receptor, the body doesn't know that it's not supposed to keep making the IL-17, so the body keeps making IL-17. And IL-17 is just the chemical that's used to talk from one cell to another. And sometime when too many of these chemicals are floating around, they could cause some mischief. They can interact with other kind of interleukins, that's what IL stands for. And it's thought that it might be a cause of what's known as MACE, M-A-C-E, major adverse cardiovascular events. And additionally, it might have some sort of adverse effects on brain function. Now, there are some competitors, one known as Taltz, the other one known as Cosentyx. You hear ads for these all the time on the television. They block the IL-17 itself, not the receptor, but the IL-17. There is a big difference. Well, what's the problem with this drug? There is a major problem with this drug, at least one major problem. And the problem caused the Food and Drug Administration to put the most severe warning on the label of this drug. It's called a black box warning. And it says that patients who have either suicidal thoughts or behavior are at risk when they take this drug. And if you want to take this drug, you have to participate in a Food and Drug Administration program. It's called the REMS, Risk Evaluation and Mitigation Strategy. It's a one-time event for the doctor. The doctor has to counsel the patient, tell the patient that, hey, if you take this drug, you might increase your risk of suicide. The patient has to understand and be taught that if the patient takes the drug, if they've had a history of depression, or if they've had a history of suicidal ideation, suicidal thoughts, they might come back on this medicine, or they might start anew while taking the medicine. And if you have any thought of doing yourself in, committing suicide, better see a mental health professional. And additionally, the drug might increase the risk of certain kind of infections and allergies and autoimmune conditions. The black box warning is very specific. It makes all sorts of references to potential harm that can come to patients who take this drug because they either become depressed or suicidal. seems like it's a pretty substantial problem for a drug just to treat a skin disease, especially when you have a lot of options available that you could use instead. Well, fortunately, it has some simple side effects. It might cause you a headache or joint pain, might cause you some fatigue or some pain in your throat, some diarrhea, numbness, or tingling of your extremities. That seems like a mild burden in comparison to the suicide. Well, if you have Crohn's disease, inflammatory bowel disease, you shouldn't take it. And there's a problem in patients who have chronic infection. If you have chronic infection, you shouldn't take it, or recurrent infections, or if you've had a history of tuberculosis or your TB test is positive, again, you shouldn't take it. We know that IL-17, when we get too much around, might disrupt the blood-brain barrier, so it might cause some inflammation in the brain. It also causes, the drug causes, a low level of white blood cells, specifically the white blood cells that fight infection, so you might develop an increased incidence of upper respiratory infection, sinusitis, nasopharyngeal problems, and theoretically, a problem with yeast in the mouth or other places, and chronic staph infections. Well, the safety review of brodalumab, when it was being conducted, first discovered late in the course that suicide was a possibility with this particular kind of drug. In fact, 4 people on the study for psoriasis committed suicide while they were taking the drug. 2 who had a history of mental disease, but 2 who didn't. And they were doing some other studies too. One with rheumatoid arthritis, patient committed suicide. One with psoriatic arthritis, another one committed suicide. So it's thought that there were at least 6 people who committed suicide, probably 11 or more people otherwise thought about committing suicide. Whether cause and effect, we don't know. One of the patients might have been a drug overdose, but we don't know that drug overdose wasn't related to some sort of a problem with the medicine. When it went to the FDA has multiple divisions. The Division of Epidemiology, they thought that there wasn't currently enough information available to determine whether the drug was safe and effective for use, and the Division of Psychiatric Products said, hey, we ought to do a study looking at suicidal ideation before the thing is approved, especially because there are a significant number of other medicines on the market that are available to do exactly the same thing, but they don't seem to be associated with with the suicide. If you decide to take the medicine, it's a subcutaneous injection, sort of like insulin. Comes in a pre-filled syringe. The dose is you take it initially, you take it 1 week later, you take it another week later, and then after that you take it every other week. You keep the medicine in the refrigerator, you take it out for a while before you use it. You keep it out of the refrigerator actually for up to 2 weeks. If it's out of the refrigerator for more than 2 weeks, you ought to throw it away. It comes in a carton of 2. There was a study, one of the major studies prior to its approval, and what they did is they looked at patients between the ages of 18 and 75 who had moderate to severe disease. They had at least 10% of the body surface area involved. They had their psoriasis for at least 6 months, and they found that the drug was better than Stelara. Stelara is one of the commonly used anti-psoriasis medicines, and they looked at the likelihood that the patients would be at least 75% better by 12 weeks. Okay, so taking the medicine as directed for 12 weeks, what's the likelihood that you would be 75% clear? Well, Enbrel, advertised quite frequently, is about 50%. With Remicade and with Humira and Stelara, it was about 70%, about 80% with Cosentyx, and higher than 80% with either Taltz or Siliq. Physicians evaluated the patients and saw how the patients did. They came to the same conclusion. And when we look at the likelihood of being clear, completely clear of the psoriasis, by 12 weeks, the only 2 that were evaluated were Taltz and Siliq, and both of those came in at somewhere around a 40% improvement, complete improvement. Now, if the patient has not achieved adequate improvement by 12 to 16 weeks of taking the medicine, you ought to consider discontinuing it. Well, there's 6 completed suicides. And we always have to get back to that number, 6 completed suicides. So how does it compare to the other medicines available for psoriasis? Well, at least it's 3 times more risk taking Siliq than any of the other medicines, even though the numbers are relatively small. But they are there, and it caused such a problem that the main sponsor of the medicine, Amgen Pharmaceuticals, said, hey, we're going to stop all of the studies, and we're going to consider getting out of here, because we think that if the FDA ever approves it, as they did, that it would have severe restrictions, as it does. So one of the major pharmaceutical companies didn't want to have anything to do with it. And it was recommended early on, when they found out that there were some suicides, that the patient undergo some special psychiatric testing, some monitoring, to see if they were okay. And as a matter of fact, we know that if you're going to take this medicine, you have to be evaluated. Well, if you have a history of depression and you take Siliq, you have about a 7-fold increase in your risk of committing suicide or thinking about suicide versus if you don't have depression. And a lot of people have depression that's undiagnosed. And if you've ever thought about committing suicide and you take Siliq, you have about a 12 to an 18-fold increase in your risk of thinking about suicide again or committing suicide. Well, if you look at patients who have psoriasis, somewhere between a third and a half have some sort of mood disorder. And the mood disorder might be depression or anxiety, might be a thought of suicide, or might be even substance abuse. We don't know why patients who have psoriasis have such a high level of depression, but it might have to do with a quality of life. It might have to do with body self-image. It might have to do with social anxiety, or it might have to do with some chemical changes that occur in as a result of maybe some inflammation, chronic inflammation. Maybe it has to do with an altered hypothalamic pituitary axis, some of the hormones in your body. Maybe it has to do with some changes in the nervous system. But we do know that patients who have psoriasis are at increased risk of mood disorder and depression, and if you take Siliq, that might really be a potential problem. Now, we've emphasized suicide, but unfortunately, remember when we started off talking, we said that there was a possibility of the major adverse cardiovascular events? Well, in the psoriasis studies, 4 people committed suicide, but 13 people died of heart-related disease, cardiovascular disease. 4 of them died of heart attacks, 3 of them died of sudden cardiac death, 2 of them died of stroke, 4 died of other cardiovascular disorders, and 1 person died of a pulmonary embolism, 1 person died of a ruptured aortic aneurysm, another person bled out because of esophageal hemorrhage. There were some other accidental causes of death. So it seems that we're dealing with potential problems that might want to guide you to take a different kind of medicine than Siliq. If you look at the major adverse cardiovascular events, we call them cardiovascular death, stroke, or heart attack. And we look at within 42 days of taking these medicines, what's the likelihood of problems? The likelihood of problems is increased. And it's increased. Let's say you have a history of cardiovascular disease, a history of ischemic heart disease. You have a 9-fold greater risk of having a major adverse cardiovascular event if you're taking Siliq, and if you have a history of cardiovascular disease, you have at least a 5-fold increase in your risk. Now, the history of the drug goes back to 2008 when they got an IND, investigation of the drug. It was originally going to be marketed by Amgen Pharmaceuticals in conjunction with AstraZeneca. They were going to develop the drug, and they did. And then they found some psychiatric problems associated with it in 2014. Then in 2015, the FDA, when they realized what the problem was, said, hey, let's have a talk. And they called Amgen in, and Amgen said, we don't want any part of this. We're out of here. We're going to stop all of the studies. And that's when AstraZeneca took over. Well, AstraZeneca sort of got to thinking about it, and they said, we want a partner in this so that we can sort of give it to them. And they found it in Valeant Pharmaceuticals. Valeant Pharmaceuticals has had a checkered past, let's say. The former president of the company, J. Michael Pearson, he made the deal for this drug. He was going to give the AstraZeneca folks hundreds of millions of dollars. And he did. And he got the drug. Well, subsequently, he was called before Congress for testifying in front of investigating committees for all sorts of ethical shenanigans and price problems and other corporate shenanigans. I think that would be a good word. Well, you have to realize that these drugs might have the tendency to cause cardiovascular disease. There was another one called brachiumab. That was a drug that was going to be used to treat psoriasis. And when they found an increased incidence of major adverse cardiovascular events, the company withdrew its application both to the FDA in America and to the EMA, or the European Medicine Agency, in Europe. They didn't want any part of it because they knew that they were going to have problems. So how much do you have to pay for a drug that might want to cause you to think about suicide? The company says, we're going to price it less than our competitors. We're going to price it at $3,500 a month, or $42,000 a year, or in excess of $100 a day. But I'm sure the company is going to come out with some of those prescription savings cards, so you take it over to the pharmacy or you do whatever, and you're only going to have to pay maybe $50 copay, $25 copay, or maybe no copay. They're going to stick it all to the insurance company that later on is going to raise your rate because there are so many people taking these medicines that may well not be appropriate. Anyway, it sort of reminds me of the theme song from MASH, the movie and the TV show. Do you remember that? Suicide is painless. So what's my take on the drug? I think it's absolutely ridiculous. It was developed by a company who got out of it because they realized that there was significant problem. Then the second company that was in it bailed out of it. It was bought by a company that is suffering significant problems. After all, they had to oust the former president of the company who made the deal to take the drug over. It's going to be sold for $42,000 a year, or more than $100 a day. You have to go through screening to make sure you're not going to commit suicide. It might cause you to have heart disease. It's only in our crazy system. I'd stay the heck away from this particular drug. I would consider some of the other medicines as much better alternatives. You have to realize that these things haven't been on the market all that long, and this particular drug already, in its very short history, has shown to increase the incidence of suicide and heart disease. Come on, that's ridiculous. Anyway, thanks for watching. I'm Dr. Ken Landau.